I'm Dr. Bharat Pankhania, Senior Clinical Lecturer, University of Exeter Medical School.
Thank you so much for agreeing to speak to us today. Can you give us an outline of coronavirus, please? Tell us a little bit, first of all, about what we know and how it transmits between people.
So this is a new virus. It has emerged from bats and gone through an intermediate host, and now it infects humans, and it transmits between humans, and therefore it's a communicable disease of humans, and it's causing severe disease and making some people extremely ill, and unfortunately some people are dying.
And how is it that it actually transmits?
It's transmitted as what we believe as droplet spread. And what I mean by droplet spread is secretions from nose and mouth. And what happens is you may be infected and infectious, so you have a little secretion and it comes my way and then it finds me and I get infected.
And what do we know so far about how it differs from flu?
So the seasonal influenza virus is, in comparison, quite mild compared to the coronavirus. The coronavirus is a beast, it really is. It's an awful beast. For any age group, it is more harmful than the seasonal influenza virus. For the age 60 plus age group, it is unbelievably harmful. So, the case fatality rate for 60-year-olds plus is rising from 3 to 4 to 6 to 8 to 10 case fatality rate. That is extremely high. So that's serious for people over 60, especially those with underlying health conditions, diabetes, heart disease, kidney disease, liver disease. They seem to be getting a tremendous hit.
And this has now been declared a pandemic. What does that mean?
Pandemic just means pandemos, which means an epidemic that affects all people. So it's an infectious disease that not only affects all people, but it is throughout the globe. And it is spreading fast and it is sustained. That's the other key word. So in other words, not only does it infect, but it spreads and it infects a lot of people, and it is sustained, meaning it carries on doing that.
So in this phase, what can people do to keep themselves safe?
There is not a lot we can do. And because there isn't a lot we can do, the little bit that I want to tell you that you can do is do all you can not to get infected. How do you not get infected? Well, as I said earlier, it's droplet spread. And because it's droplet spread, it means the range of hitting you is about 2 meters, 6 feet. So somebody who is infectious and hangs around you may give you a hit, and if you're within 2 meters of them, you might unfortunately get infected. So you want to stay away from them if you can, because you don't know. They might not be showing any signs of infection. The other route is contaminated surfaces. So there may be a dirty door handle, there may be a dirty table, there might be any surface, and you pick it up. You pick it up and introduce it to your mouth and eyes and nose.
And what can we do to stop that from happening? How do we reduce our risk?
So the only armamentum we have is the weakest link. And the weakest link is you pick it up on your hand and introduce it to yourself. There is no other armamentum. So what you say to yourself is you become conscious that the weakest link is my hand. And you learn how to wash your hands properly, and you timetable washing your hands. It's water over a duck's back to keep on about washing your hands. It won't happen. But if you timetable it, it will. So I would advise people to say, I'm going to wake up in the morning and I'm going to do my normal business. And then I'm going to wash my hands. And then every 2 hours, I'm going to wash my hands during this emergency. And when you wash your hands, you need to think about it. So instead of daydreaming about whatever you wish to daydream about, I would say focus on what you're doing. Focus on washing your hand. So you think about, I'm washing this. Think about it. Develop your own template. And if you develop your own template of whichever sequence you're going to do it in, you will do a much better job than to sing away and think about it and think about something else and you're going through the motions. You're not focused on washing your hands. Focus on it. But one more thing, please, this is very important. washing your hands is not good enough. You've got to learn how to dry your hands too. This is very important. People don't wash their hands properly and people don't dry their hands properly. They're both important. One more thing. You must wash your hands before you eat food. Learn and make it a habit.
And thinking about our university environment, we've got shared living spaces, we have lectures and group spaces. Is there any advice that you would give specifically to staff and students at the university on keeping safe and reducing their risk of infection?
Based on the evidence that we now have, I'm very concerned about people who are aged 60 plus. The evidence indicates that if you have an infection and you're aged 60 plus with underlying medical conditions, the infection is more severe. Therefore, I have an age-specific advice for people, which is people over 60, if you get infected, you could be severely ill. I'm sorry, I wish this wasn't the fact, but it is. Therefore, I would really advise people in that age group to exercise extra caution.
So, obviously, most of our student and even staff community are likely to be under 60, but I'm sure that there will be people who are very concerned about carrying the illness and passing it to more vulnerable people. So is there any kind of advice that you can give to people in that circumstance?
We can do a lot, and we should. So I've given my age-specific advice. My other general advice to everyone and anyone is, please don't get infected. This is very important. So do all you can, because just because you think people in this 20-year-old age group don't seem to get a big hit from infection, that doesn't mean you get infected. Do all you can not to, because if you get infected, you make cases as well. The other thing is you exercise good care and good hygiene. The other important bit is if you have even the semblance of an illness, you exclude yourself from circulating, because you could make your friends' parents, and other people ill. So it is a very good, important social responsibility not to circulate if you have an illness.
And what symptoms should people be looking out for? What should be the trigger for that self-isolation?
Symptoms, unfortunately, are not very specific. But the ones that we know are related to coronavirus infection are as follows. So you have aching limbs, aching, tiredness, that's your muscles hurting. The second one is you may have a rash. The third one is you will have a fever. And the fever, is a temperature 38 degrees centigrade sustained over 2 days. That's pretty good. That's a good sign, in that at least it's measurable and you can detect it. The other things are vague, but temperature is measurable. And then later on, moving on, is cough. The peculiar cough of a coronavirus infection is a dry cough. And the peculiarity of the coronavirus infection is not a runny nose. It's a dryness. So there's a dryness and a cough, and a dry cough. One more thing. You may experience shortness of breath. Now, if you experience shortness of breath, it's indicating that you may be developing a pneumonia, a viral pneumonia. So we need to be aware of this and act fast. So you would need to have medical intervention, or at least consult with your doctor if you're getting short of breath or you're having difficulty breathing. This is important.
And self-isolation, what does that look like? What kind of advice have you got for people who want to self-isolate? And again, specifically thinking about shared living arrangements.
It's very difficult, very difficult. You have to think of yourself and picture yourself as somebody glowing red or glowing a fluorescent color. So think about it in that line. So if you think of yourself as, red, hot, glowing something, full of germs, which you will pass on to others, then you will actually undertake self-isolation much better. And what I mean by that is you're isolated, you're infected, you're infectious, don't infect others. So picture yourself with that glowing fluorescent light, and wherever you go, whoever you mingle with, you could be passing it on to them. So if you are infected and infectious, you really need to be on your own.
There have been, unfortunately, some incidents of racism, nationally, where people have picked on a particular nationality. What's your kind of view on that?
Look, this virus emerged in China, but equally well, it could have emerged in Africa, America, or anywhere. That's one point. The second point is, if you're abusive to any other person from any other race, you're actually being abusive to yourself, because we are one race, the human race. The third point is, it's not a nice thing to do. It's not a nice thing to do on many parameters. And this is a global issue. This outbreak is all over the world, and you could all do your little bit by being socially fair, honest, don't hoard, and be nice to your fellow human beings. It's not a lot to ask for.